it's CJ. Today I'm going to tell you what you can expect regarding prenatal care now that you have a positive home pregnancy test. First things first, they're probably going to have you do a pregnancy test in a medical setting to confirm that you're pregnant. Once that's done, you'll make an appointment with your OB provider. Usually that first visit is scheduled for sometime right around 10 weeks, unless you have a past medical issue such as diabetes or recurrent pregnancy loss, in which case they'll probably want to see you sooner than that. Prior to your first OB visit, your provider is going to want you to start taking a prenatal vitamin. It can be over the counter or it can be prescription, whatever works best for you. They will also most likely order some lab work, both blood as well as urine, which ideally you will complete prior to your first visit. On the day of your initial OB visit, here's what you can expect. They're going to want to get a thorough history, including the first day of your last menstrual cycle, any past medical history issues with you or your family members, previous surgeries, medications that you're currently taking. They need to know if you've been pregnant before, outcome of those pregnancies, how big were your other babies. They need to get your height as well as your weight. They'll figure out your BMI, your body mass index. They will let you know what the recommended weight gain is for you during your pregnancy. And most likely, they will give you information regarding nutrition during pregnancy. They will probably talk to you about genetic testing options, what is available to you, the risks versus benefits to each test. If you have not already had an ultrasound, they may do one that day or they may order one. The purpose of that ultrasound is to make sure that the baby is in your uterus where it belongs, to establish your due date, and finally to see just how many babies you have in your uterus. If your OB has determined that you are at increased risk to develop preeclampsia later in pregnancy, they may recommend that you start taking a low-dose aspirin every day at 12 weeks. And finally, they will probably schedule your next OB visit, which will occur in about 4 weeks. I do hope that this information has been helpful and that if you have questions, you'll let me know in the comment section below. And while you're in that comment section, I sure would appreciate it if you'd hit the like button or even feel free to share this video. Hello, it's CJ. Thank you so much for watching the entire video. I truly do hope that the information has been helpful. When I make these videos, it is not meant to replace a visit with your healthcare provider. Rather, my hope is after watching my video, you know what questions to ask your provider at your next visit to best meet your own healthcare needs. In the meantime, if there's any questions that I can answer, I hope you'll reach out to me. And finally, if you have not already subscribed to my channel, I'd really appreciate it if you did that. That's all I have for today. This is CJ, and I am at your cervix.